Hello, my name is Irene Cuevas. I currently work at University Medical Center. I actually did an interview with my performance improvement coordinator, Daniel Lopez, in regards for our class on nursing leadership course at UTEP. Daniel Lopez went over three of our main concerns at University Medical Center. One of them is pain management, falls, and infection. Daniel Lopez, when he was hired at University Medical Center, and last November, he noticed that falls and infection have been actually decreasing. What he has been noticing that pain management has been a struggle due to nurses not being consistent with documentation and accurate. And that's for PO medications and IV medications. We have to assess and reassess. With 1 hour, we have to reassess with PO medications. And IV medication, we have to reassess within 30 minutes. One of them being PO medications like gabapentin, baclofen, Flexeril, and naproxen, ibuprofen, Vicodin, and Tylenol number 3. One of the lines in between is Toradol, depending if it's going to be PO or IV, and the other one's morphine and fentanyl. And actually, as well, they've been doing Daniel Lopez has been actually doing daily audits to see how it's going to be improved. Our nurses standards that we're trying to meet is one from the Joint Commission. It's the R3 report issue 11, pain assessment and management standard for hospitals. Use medication safety and identify patient and resident safety risk. The support, one of the ways to support our initiative is by the service, patient service. Managers have actually been going in during their hours and actually asking patients if they're satisfied with their pain level. If not, how is it being addressed and by whom? As well, Daniel Lopez did mention that he's doing daily auditing charts, making sure that nurses are actually documenting consistent, that they're not only doing the pain assessment, reassessment within the time manner, and as well the pain level, if it's according to their the pain level. If it's 0 to 3, are they giving that Tylenol? 3 to 6, if they're giving that Tylenol, Vicodin, or if it's greater than 7 to 10, they're giving like morphine or fentanyl, one of them stronger narcotics. Measures that are being that we're working to improve are to increase patient satisfaction. We're assessing it with the surveying the patients and monthly reports. Daniel Lopez is actually reviewing and doing the audits, and he does send reports on a monthly to a quarter basis to our managers and quality improvement. Going that for that's how it's being collected. Like I did mention, our PI coordinator with other PI coordinators with different units are actually auditing the charts daily. And then they're sending information to the managers and the managers to the nurses saying where they're lacking their assessments and the documentation. Then that reports from monthly to quarterly basis, they're being sent to quality improvement. From quality improvement, they're comparing their data to hospital basis from different hospitals in our area and as well as national standards. The agencies that actually look over our information and we have to report the information is Joint Commission is CMS, and that information / reports are being reported by quality improvement. Nursing involvement is PI coordinators, nursing indicators. They worked, Daniel Lopez and our nurse educator Evelyn Barrios worked together to do a plan of action. With that plan of action, they assess and check and ask nurses regards on what do they think about the pain management. They take it into consideration their opinions and their disagreements. Going that our nursing educator actually informs the nursing staff on what they're lacking and how to improve it, and if actually the nursing staff have some tips that actually can improve timely management. And we also try to involve other units as well. Multidisciplinary team are pharmacy, nurse management, PI coordinator, nurse educator. Pharmacy actually gives a list like I did mention, I have the medications that we're actually supposed to assess and reassess, and they give us the time that we're supposed to assess. Nurse management looks over that information and addresses it and gives it to PI coordinator. Then PI coordinator involves a plan, and the nursing educator goes out to the nursing staff and tries to implement those changes. The challenges that UMC is going through right now, or the staff, is non-compliance with documentation. There's nurses who are resisting, who are not wanting to do the pain assessments due to the fact that PI coordinator and nurse managers did include it that we're supposed to assess and reassess schedule pain medication, which it goes to. Sometimes patients get gabapentin, baclofen, Flexeril, naproxen, ibuprofen, Tylenol-3, and Vicodin on a schedule basis. So it could be from every 4 to every 6 or every 8 hours. If you think about it, it's they have to go back and do it at consistency, and that's one of the resistance that nurses are doing. They're not wanting to do, and they're unhappy with. And as well, travel nurses for a time during a time period, we were very short staffed, and we had help with travel nurses. But since they have a short stay, they work on a short stay in the hospital, it's really hard for them to comprehend and the priority and the value behind pain management, because when they learned the pain management, they have to leave. One way to alleviate recommendation is time management. Actually teaching nurses how to actually do pain assessments while they're working, education, training, documentation on time, and the main reason, understand the value and importance regards on the pain management. Like I said, reimbursement is one, and patient satisfaction. Changes, in case a nurse is not happy with the changes or actually has an idea on how to improve, they can go to a PI coordinator. PI coordinator works with a nurse educator and manager to see if it's able to help the pain management. And then if it's a hospital change, then they have to go to different committees like pharmacy. They have to talk to pharmacy. If it's appropriate, and they have to overlook that information, and they go to submit paperwork to different committees. So it's like a longer process. Other departments involved in this modification could be informatics. Certain is not, it's actually a little bit difficult for nurses to get familiarized, so informatics can get involved. Managers overlooking the information. Nurse educator and the PI coordinators work along together to actually address and meet those needs for the nurses, and as well give them a little bit of feedback on how to improve their skills. Other departments, like I did mention, they gather, all the PI coordinators get together and gather a baseline of all the units of their payment. Of course, every unit is going to be different. Of course, telemetry is not going to have as much pain management as a surgical unit, but they want to get a baseline from each one to see if they're improving or not. If in the case that they're not improving, they're going to have to do some modifications. Main accomplishments, of course, is having a higher patient satisfaction. We want reimbursement, and of course, increased knowledge on nurses to do assessment and reassessment. And of course, for nursing staff to advocate for pain management. Of course, one of the that we're dealing with right now is budgeting. We do have a 6% cut on our hospital, which means less staff, less education. They're not allowing overtime, so nurse educator, PI coordinators have to work around within their schedule to give information, to educate, and as well staff nurses have to take away from their patient care to get that information. So it's a little bit difficulty. One of the timeline is actually that Daniel noticed, and actually he did implement it, that he wanted by the end of the year to have a 93 to 95 compliance. Right now, we do have between an 88 to 93 compliance. So, of course, it's going to take some time, and hopefully we do get to the 95 compliance over time. And actually, that concludes my video. And like I said, pain management is really big in our department of surgical, ortho trauma, and women's surgical, to being, of course, surgeries and involving pain. And thank you for taking your time for watching this video, and let's always do pain management.